The Attachment Disorder Institute is very excited to be co-sponsoring this event with Dr. Joseph Crumbley, with UW-Tacoma Arts and Lectures, the Child Welfare Training and Advancement Program, and the Social Work Student Organization. I think it's a wonderful collaboration, and we're thrilled to be here. So thanks for coming out tonight. I want to talk with you about Joe Crumbley. I first met him in the summer of 2002 when we were both hired to be the elder clinicians at Kinship Camp in Southern California, where we worked for 5 days at camp and had time to get to know each other. And we worked. I have been fascinated by Joe since then and asked him when I met him at camp if he'd be willing to come to the Puget Sound area and talk with us about the two very important topics that have been identified by the state of Washington as the two most important issues facing children in this state, and that is transracial, transcultural placement, and kinship care. And who better to do that than Joe, who is an author of 2 books on those topics, one on kinship care, the other on transracial placements in adoption and foster care. So we got the whole package in one terrific individual. Joe is a social worker by history. He's in private practice in the Philadelphia area, and he's a consultant and family therapist and in demand internationally for his expertise. So we are just thrilled that he's here, and so very pleased to be spending the next couple days with him. Joe is a wealth of information. His perspective on the topics to be presented are new and refreshing, and he's just the nicest man I've met in a long time. So I'm very pleased that he's here, and please welcome Dr. Joe Crumbley.
Thank you. Oh, okay. Let me tell you a little bit about who I am and how I've been involved in kinship care. Let's see. I guess for about the last, I'd say maybe 15 years, I've been working in a program in Philadelphia where I've been providing family therapy in the homes of relatives, raising the children of mothers who are incarcerated. Did all that fit together? Okay, all right. And what I'm doing primarily now is supervising family therapists and social workers who work with these families. And so I'm kind of wearing 2 hats tonight, a clinical hat, and the clinical hat kind of starts off as, basically therapy in the home with relative caregivers. And these are relative caregivers raising the children of mothers who are incarcerated. The other thing that I do in this program is also work with the children as well. And what we do with the children is we have them in groups, and we have school children ages 6 to 12. Hi. And then we also have children that are adolescents. And we have 2 groups, and they come to the groups to deal with their anger and their loss and their grief and their hurt. They talk about how they explain this to their friends. And the third thing that we do also is that we actually take the families to Muncie, that's the women's prison, and we meet with the mothers there. And the room is pretty much very similar to this with rows of chairs. And the mothers kind of block themselves off, they'll section themselves off in the rows. And basically it's kind of like family therapy in the day room, all right, where we deal with everything from what time the kids should go to bed, to when they're old enough to date, to what they're going to wear to the prom, to reinforcing the relative caregivers' limits, to the children asking parents about why you're in prison. And the mothers that are there, they've covered, the sentences are from 2 years to life, to even some others who are on death row. So that's the whole array in terms of what we're dealing with. So that's my clinical hat. And then there's a personal hat. Personal hat is that I was involved in raising my grandson as a relative caregiver for the last 8 years. And he and his mother just moved out last October. You see that big smile? That's terrible. Does that smile tell on me? It doesn't. I really enjoyed it, but it was so nice, when they did finally move out. So as I talk to you tonight, I'm kind of talking as the clinician, and I'm also talking as a relative caregiver, so I'll be drawing from both of those experiences, okay? Can I tell you about my personal side? Yeah, okay, all right. Let's see, my daughter was 17, and she went to college, first semester on the dorms, and she met a guy in college, and they fell in love. And 2 months later, I'm actually on a travel doing some training. She gives me a call and she says, I'm her stepdad, since she was like 13. So it was kind of like, Dad, I need you to help me not tell Mom that I'm pregnant. Did you hear that? Help me not tell Mom, okay? So I said, honey, now you know we have to tell. So we told her mother. And so we got her through that first semester. That started in September. Got her through first semester. Got her through second semester. She had the baby that summer, August. And then we thought she was going to start back to school in September. And she tells us, she's now 18 at that point. She tells us that she and the young man, they're going to get together and they're going to be responsible young adults and they're going to raise the child and she's going to move out and live with him. So her mother just goes off. Wait a minute, I didn't raise my daughter to shack up with some man. You know, you're going back to school. If you leave here, don't plan to come back. That's it. So as my daughter's packing up and moving out of the house, I'm saying to her, listen, if it doesn't work, just come on back. But don't tell your mom I told you that, okay? So about 3 months later, she comes back, baby on one hip, diaper bag on the other, and just the clothes on her back, and she's knocking on the door, and there had been some domestic violence. And she comes back to live with us. And guess how else she came back? How else do you think she came back? Pregnant. Yes. Sounds like some of you have been there. But similar to, yeah, pregnant. Right. So that's how she came back to me, and that's how I got involved in kinship care. You know, but it was kind of, it's been good. You know, it was 8 years, and she's married, and she just moved out on her own. She has her own home, went to undergrad school, finished law school, and she's doing pretty good. You know, so, but that's one of, oh, thank you. Okay. Yeah, but really that's kind of one of the lucky stories in kinship care, all right? Because for a lot of relative caregivers, they're not that fortunate. And for a lot of relative caregivers, it doesn't always work out quite that well, all right? So as I talk to you, I'm kind of like drawing from both experiences. And let me try to make it personal for you, okay? Okay, let's imagine you got a call just before you came here. And your brother and sister asked you to take your niece and nephew and take them into your home, plan to raise them for a while. They're not quite sure how long. And they've asked you to take them maybe because maybe they're ill, or maybe there's been a divorce or separation, or maybe they're relocating. But they've asked you to take their niece and nephew into their home. So here's my question to you. How would it affect you emotionally? And what changes would it make in your life? And what's today? Wednesday? You have until Friday to get ready. And that's very typical for a lot of relative caregivers. I'll give you till Monday, all right? We can stretch it out, all right? So how would it affect you emotionally, and how would it change your life? And you can just holler it out, and I'm just going to kind of write it down here.
Daycare.
No, somebody says daycare. Okay. Change in work schedule, okay. Work schedule. A bed or a room. Did I hear food? House rules. Ooh, she said it doubles the kids in the house. Okay. Baby CPR. Okay. Anything else? How would it affect you emotionally? How would it change your life? Money. Someone said money. Okay. Anything else? Social life. How many people in here are single? All right. Okay. All right. Social life. What else? Affect you emotionally, change your life.
Your grandparents, and I would worry about energy and stamina.
Okay. We have some grandparents here, and the comment was energy and stamina. Would this be your second time around? Do you have children?
Yes.
Oh, okay. All right. Mm-hmm. All right. Generation gap. Shock. Okay.
I think that's what you're hearing now.
Excuse me? Fear. All right, let me add another piece to this scenario. You also just found out that it was because maybe your brother or sister or your daughter or your son Maybe has a drug problem, or maybe it's because of abuse or neglect. In addition to all these other feelings, how else do you think you might feel? Anger. Worried. Oh, by the way, if there's some positive feelings in this, you can add that to the list too. I mean, I didn't want to just limit it to all negative, you know. Anything else? Yes.
I want to get a pediatric checkup.
Pediatric check for the children? Yeah, okay. Anything else?
Big lifestyle change.
Lifestyle change.
The biggest thing for me would be that need to understand.
Need to understand. To understand why or how or yeah,
Why
yeah,
and how and the what and where.
yeah, okay. She said the need to understand the why, the how, the what, and the where. Okay. Yes.
Kind of who's going to make decisions or
Mm-hmm.
who's going to be in charge of
Yeah.
the kids and the parents.
Right. Who's in charge? I like that. Because as opposed to like who's in charge, is it going to be me or you or my brother or my sister? Okay. Who's in charge?
And then boundaries.
Values. I like that comment. Yeah, it's kind of like dual responsibilities. And the point was not only for the children, but for the birth parents. I like that. Time frame, how long? Did I hear that? Yep.
Whatever they want to.
Anything else? Grief and loss. Of your own or? Ooh, okay, I thought so. Children, self.
Impact to the child.
Impact on the child, right. How many people here have husbands or wives or spouses or boy? What do you think happened to them? See, did somebody say resentment? Okay. Excuse me? Could also be a strength. All right, if you survive all this, you will be strong. Right? I understand your point about strength, yeah. Because it certainly taps into a whole nother level you don't even think about. Good point. Okay, all right. Quite a list here. All right, now the reason why I wanted you to kind of go through that exercise, because I just wanted you to kind of get an idea of what relative caregivers feel when they go into kinship care. All right, because these are all the feelings, these are all the kinds of issues that they're addressing. Well, let me ask you, who's usually the relative caregiver that's providing kinship care from your experience? Grandparents, grandmother or grandfather? Grandmother. Maternal or paternal grandmother? Maternal. Yeah, that's exactly what the research is showing. It's a maternal grandmother. Age range? 50 to 60. Anything else? All right.
45 to 60.
Yeah, 45 to 65. What's the youngest a grandmother might be? How about 30? Right. Teenage pregnancy, cycle pattern. All right. What's the youngest a relative caregiver might be? 18, and who might it be? Brother, sister? Okay. What system do you think these brothers and sisters are coming from? Because you're right, they're brothers and sisters, they're young. What system do you think they're coming from? Child welfare, foster care. I throw that out only because you just need to know that the face of kinship care might be changing over the next 10 years. You know, we're not sure, but it would be interesting to watch what happens, you know, in terms of getting younger and the relationship. But right now we're primarily talking about relative caregivers who are grandparents, grandmothers, 45 to 65. Are they usually taking care of only one child? No. Yeah, that's the other thing. It's usually not just one child and a grandparent in a home. You know, I bet you that, I'm sure a lot of them wish it would be just that simple. It's usually multiple children, multiple caregivers. It's usually intergenerational. Okay, so that's the profile that we're looking at. Now let's look at let's look at family dynamics, okay? Because I think it's also important to look at what happens in kinship care when the child is moved. And let's take that profile that we're looking at from the child's perspective. We have the grandparent. We're going to make this the aunt. We're going to make this the uncle. We're going to make this the birth parent. Okay? So these are obviously sibs. Let's give the aunt a child. This is the identified child. Let's also give the uncle a child. So these are cousins, right? Okay. When this child moves into care of the grandparent, where does this child position shift on the genogram? Is it up, down, over? Which way? Up. Okay. Tell me when to stop. Okay. All right. This child's position has kind of like landed on the sibling level, right? Okay. What do you think this aunt and uncle is saying to this grandparent about this child being in the home? Better yet, what would your brother or sister say to your mom about raising a niece or nephew? You can make it real personal. What would they say?
It's not your child.
Not your child. You shouldn't have to do it. What else? It's not your responsibility.
You're supporting the birth child's disability.
You're supporting the birth child's dysfunction. What else? How do you think they would feel about these children of their own? What would your brothers and sisters say then?
You're
Favoring this one. What else? You're not giving them my children, grandchildren equal time. Okay, let's take it another step further. What do you think this birth parent is now saying to the grandparent, which should be mother or father?
Trying to replace me.
Trying to replace me? What else? What do you think this birth parent is reminding this grandparent? How to raise the children? What else? Excuse me? It's my child. I'm still who? Right. Mom or dad. I'm still the parent. What do you think this birth parent is saying to the child? She's not your mom.
You don't have to listen.
You don't have to listen.
I'll be back to get you.
I'm coming back to get you. I'm still your mom. Okay. All right. Let's take it one step further. What do you think this child might be saying to the birth parent?
She's too strict.
Too strict? What else? I hate you. Okay. Yeah, you left me. How about that? What else?
Why don't you come get me?
Come and get me. You can't tell me what to do. I'm going to tell grandmom on you. Can you hear all that? Okay. Did you hear a little bit of rivalry in here? A little bit of competition? Okay, let's muddy it up a little bit more, because you're right with me on this now. All right, child moves to the care of the aunt. Position goes over here, right? What do we hear this cousin now saying to the cousin that's moved in? That's not your mom.
This is not your house.
This is not your house.
When you leave.
When are you leaving? What is this child now saying to his mother?
You don't love me anymore.
You don't love me anymore? How long is he going to be here? Excuse me? He being a tattletale? When are you going to send him back? I guess what's interesting here in kinship care is that pre-existing relationships, roles, interaction changes. Make sense? You see how it does? Okay? Because they weren't talking like that when this child was down here with the birth parent. And that one simple move has caused all this different kind of dialogue, possibly sibling rivalry. If this aunt and uncle have had issues with this birth parent, where do you think it gets transferred to? The child, you see what happens? So when we look at kinship care, and we're talking about moving children in kinship care, you've got to be looking at changes in family dynamics, and the dynamics are the changing in pre-existing relationships, roles, and interactions between family members. This is different from foster care and adoption, different from stranger foster care and stranger adoption. Because of one reason, there were no pre-existing relationships. The foster parent starts off as the foster parent. The foster brother starts off as the foster brother. So when you look at relationships in terms of what happens in kinship care, it's changing those pre-existing relationships and making those transitions smoothly occur. That becomes the challenge in kinship care. Okay? Now, don't get me wrong. Is kinship care new, by the way? No. Right. Yeah. Okay. So these issues are not new. Families have been dealing with this for generations, for years. Is kinship care specific to any racial or cultural group, do you think? No. No, right. As long as there have been absent parents, parents have had to deal with kinship care. So really, they've been dealing with these issues for years. It's not something new. All I want you to do really is just kind of like have a mental checklist in your mind in terms of looking at the changes and the dynamics in the family, just to make sure that the family is negotiating these changes okay. Because a lot of times the family isn't thinking about these changes. It's just as they occur, they deal with it. We just want you to be a little proactive. So when you move a child in kinship care, you can already have in a checklist in the back of your mind. Let me look at this genogram. Let me look at family members. In fact, I use this map with my parents, my families. They love it. Oh my goodness, Uncle Joe fits in that box. And my daughter Mary, she fits right there. And you can put Sammy, he's right there. He's the birth parent. Even the cousins are interesting. Even the I was working with one family, and the cousin said to me about the child moving into the family, oh my goodness, that's not fair. Him being there with grandmama is like Christmas every day of the year. Isn't that interesting? All right, that kind of a move. And again, it's just a checklist just to make sure that when you're meeting with the family and you're looking at these changes, that you know how people are feeling, what new roles are being identified, how they're adjusting to the changes, because these are changes in pre-existing relationships that are new. And you just want to make sure that the families are negotiating. Oh, okay, let me complicate this a little bit further, okay? Now, this cousin just said here, oh my goodness, it's not fair. He's living with grandmom, and it's like Christmas every day of the year, right? Okay. So he sees an advantage to living with the grandmother, right? How do you think grandmom still treats these cousins, these grandchildren, when they come over? She still treats them like a what? Grandparent. How does grandparent treat this child that's now living with her as a child? How do you think this child feels about the way these two are being greeted by grandmom when they come over? Can you see the jealousy? Yeah, okay, because grandmom is still acting like grandmom. But with this child, grandmom is now acting like a parent, and she doesn't use the word no with these children. She uses the word no with this child, and it's incredible what happens here. I've even had situations where the child grew up in this configuration right here. This is the only configuration the child knew. Intergenerational, but grandmother was always in the grandparent role. Grandmother, child moves into kinship care, birth parent is no longer in the home. 10-year-old child says to me, Dr. Joe, I can't live with grandmom. And I'm saying, why? Well, grandmom, I could kill grandmom. And I'm saying, kill grandmom. You know, I'm thinking, oh goodness, medication, inpatient. You know, I'm not serious, but you know how you go through your little checklist of what you have to do here, right? So I said, why do you say you think you could kill grandmom? Grandmom told me that I could drive her to an early grave. Grandmom said that I could drive her crazy. Grandmom says I can drive her to death. But you know the thing grandparents say? Okay? And plus the attachment of the child with the grandparent is different. I mean, children will do things for grandparents that they won't even do for parents. And there's certain attachments that they'll learn, certain sensitivities and warmth and giving that they'll do with grandparents that they don't do with parents. So I'm not talking about a pathological relationship here. You know, this was grandmom's little helper. His attachment to grandmom was based on grandmom being fragile, someone to be cared for, and someone to be helped. All right, so it was a very typical grandparent relationship. I went to the grandparent and I said, He told her what she said about how he felt as though he could hurt her and wear her out because he still looked at her as very fragile. So this was a grandparent who had diabetes, high blood pressure, and he was the little helper. He helped with shopping and meals and medication. So we got in nursing services, medical services, Meals on Wheels, transportation services. So about 2 months later, he comes back and sees me. He says, you know what? Dr. Joe, grandmom's changed. So I said, what do you mean grandmom's changed? Grandma said to me, she knows what I'm thinking before I say it. She even says she knows when I'm lying before I lie. She even says she knows what I'm doing in the next room without even seeing me. You know what? She's starting to sound like a what? A mom. Now you saw what happened here. You know, if you think about how a child attaches and perceives a parent, they've got to be able to look at you as a parent who's able to control them, supervise them, protect them. They've got to see you as independent, self-sufficient, and then they can attribute and identify with you as a parent. And she was now able to do all those things. Remember now, she can see through walls. Okay, read his mind, you know, she's able to protect, and he saw her as mom. All right, I saw two expressions on his face. One was relief, and what was that from? Relief of what? Now I'm going to kill grandma, right? I'm not going to kill her, so that's the relief. But then I saw sadness, and what was that from? Yeah, he lost grandma. He lost that relationship. He lost being the buddy, her helper. Who else was sad? Grandma. That's who I had to do all my work with, right? She was the one that was having problems giving up the relationship because she was having more fun being a grandparent than being a parent. Okay, let's look at another family dynamic when we're talking about change. The grandparents' relationship, and let's look at the birth parent. All right, this identifies a peer-adult relationship, right? Okay. Here's the child of the birth parent. When this child's position shifts to here, right? Terms of authority, where does the birth parent's position now shift relative to this child and authority in the care of the child? Tell me where. Right. Okay. Now, I thought that was interesting because someone said equal in the audience. So I've seen the position shift to here, and I've seen the position shift to here. When I heard a birth parent say, oh my goodness, I feel like my mother is controlling me through who? Right. That's when I saw this. Isn't that interesting? So another thing, again, in terms of a shift in pre-existing relationships, is that there's also a shift in peer relationships related to the care and the power of the child. Different in kinship care than foster care and adoption. All right? Because again, in foster care, this birth parent is already down here, clearly, relative to the foster parent or the adopted parent. In kinship care, you have another shift, and grandparents have problems with this situation. This could also be a birth parent with an aunt or an uncle. You see how that happens? And we've got the same shift. Birth parent comes here to this level, or also can shift down here. In fact, this can even be worse sometimes because you're dealing with a sib. Imagine giving up a sib, your power and your control. And if they're younger than you, that even makes it more difficult. Okay, because at least one time you were used to your grandparent, your parent, having a power relationship, and you're kind of used to, okay, I just have to regress, but this might be totally new, you know, where you've always been in a peer relationship. So another family dynamic that you might see shifting in kinship care is a shift in peer relationships. I mean, I enjoy being able to ask I enjoy being able to ask my son to lend me $10. You know, now granted, it's the $10 I'm going to give him back the next day. But it's just nice to be able to appear, okay? Grandparents enjoy peer relationships with their children, adult relationships with the children. And then to have that shift, that becomes a problem, that becomes an issue. And then again, for the relative caregiver, it's making the shift, and it can also be a problem in the shift of relationship with the birth parent as well, okay? So I just wanted to kind of like go over kinship care again, just to look at, again, what are some of the clinical issues, and from your own personal experiences that we just did here, that exercise, you can begin to see what the relative caregiver begins to feel, and also wanted to see how there's a change in family dynamics and how that's a little different from foster care and adoption. Here's another thing that's a little bit different from foster care and adoption: how relatives, how children come into care. Remember that incident that I just gave you, that scenario? It was in a crisis. It was by default. It was an emergency. It was unplanned. For foster parents and for adoptive parents, non-related, is usually planned, is usually training, it's usually not in a crisis, and it's something they pursue. So the whole motivation in terms of how children come to you, again, is so different in kinship care than foster care and adoption. And I just want to throw that out again, just so that you can have kind of like a mental checklist in your mind in terms of what's happening to that relative caregiver and how it might look a little different from working in foster care or adoption. Because you're going to be able to tap into a lot of that experience working in foster care and adoption, but you're just going to have to kind of like modify some of those issues in terms of family dynamics, in terms of how children come into care. Yes?
What my experience, once that relationship shifts, it never ever goes back if it's a lifetime commitment, because I raise my grandchildren, and at Christmas time they don't go home to mom, they come to my house for holidays, and it becomes confusing for birth mom.
Interesting.
And some real hard feelings about where they go for Thanksgiving dinner.
Right. Yeah, the comment here is that sometimes these positions never shift back to the way they were, because you'll even when the birth parent sometimes gets it together, comes back into the picture, the example that was given here is the children may still want to come and spend Christmas with the relative caregiver, which could be the aunt or the uncle. You know, they may still confide in the aunt and the uncle. In fact, I've even seen children who got married and the parent who gave them away was the relative, not the birth parent. You know, so it's real interesting in terms of how it shifts, but does it ever really go back? Because you're right, I'm talking about changing pre-existing relationships, but sometimes they never can go back because it does alter it. So there might even be a permanent change, which I hear is your point. There may actually be a permanent change as well. Good point. And there could be feelings about that. There could be very hard feelings about that within the family as well. All right, now what I'd like to do now is kind of shift to look at clinical issues. Implicit in a lot of what people said today was this word loss. All right, even though we didn't say it explicitly, but that word was there. And if you look at kinship care, it's an interruption of life cycles. In fact, what was taught about life cycles 20 and 30 years ago has actually changed now because of kinship care. Remember, what was it before? You're single, you're an individual, then you become a couple, and then you get married, and then there's nesting, right? And then you become a parent, and then the children exit, and you become a couple again, and then an individual. I think that's what it was, that kind of life cycle. In kinship care, you become a couple, you parent, children exit, then you become a couple, then children re-enter, then there's exit, re-entry. Hear that? It totally changes. You know, the children don't seem to leave the way they used to. And for a lot of relative caregivers, it's let's do the math. All right, let's even be more specific. How many of you in here have said to yourselves, oh my goodness, when my niece and nephew are born, I'm looking forward to adopting them and raising them for the rest of my life? Right, nobody has said that, has they? Or how about this one, as a grandparent? When I have those grandchildren, when those grandchildren are born, I'm going to adopt them and bring them in my home, and I'm going to take care of them for the rest of them. Are y'all planning to do that when you have grandchildren? No. Okay. See my whole point there? All right. Different in foster care and adoption, folks. Foster parents and adoptive parents talk like that. I have an empty room. I'm looking forward to it. It's planned. It's something that you'll enjoy. You know, I haven't had children of my own. All my children are raised. I don't hear, none of you have talked like that, though, in terms of nieces and nephews. And for a lot of relative caregivers, the whole life cycle gets interrupted. You know, 45 and 25 is what? 70. and that's a young grandparent. When I used to hear grandparents say, oh my goodness, I'm raising children for the rest of my life, I used to think it was drama. No, it's not drama. The math is real clear, and that's a young grandparent, okay? Future plans not only are delayed, for some it's permanently gone. You know, for some relative caregivers, they may never ever move into that senior development community. They don't have daycare in those development centers. Okay, you see, you know, they don't have elementary schools. Now, AARP is starting to get those communities sensitive now. Like put in the daycare, put in the elementary school, make the walls soundproof, you know, so they're really getting sensitive. But space, privacy, priorities, and we just talked about relationships, okay? We know how that kind of changes. All right, let's look at some intervention. When we start talking about intervention, here are some goals. Coping with the loss, determining the threshold for loss, and being able to get relative caregivers to say it's okay to say no. I used to make the mistakes of placing children with relative caregivers and not really being sensitive to how many children were going into the home, whether or not they were matched with the relative caregiver. And the next thing I know, I was overloading relative caregivers. They were going on tilt. And the next thing I know, I was getting phone calls saying, I didn't know this was bad. I didn't know it was going to be like this. Please come and get them. So that we don't set relative caregivers to go into overload, we really need to know what their threshold for loss is. Like how many can they handle? What's enough? All right? And here's some strategies. It sounds real accounting, but you kind of have to do what I call an inventory of loss. You know, you really need to sit down and talk with them about losses, how it's going to change their life, what are the benefits, and you really want the benefits to outweigh the losses. You've got to have a balance in there, and they've got to be able to live with those losses that they can't that don't balance out. So it's really important to do that. I think it's also equally important to have these kind of conversations. And what I tried to do here was just script what those conversations should look like that you might want to have with relative caregivers. When is enough enough? How many children? Number of children? Age of the children? Types of problem that the children are going to be bringing. You have to be okay for the child to be okay. Got to give relative caregivers permission to be selfish. That's really what that conversation is all about. You've got to be okay for the children to be okay. If you're not okay, the children may go or return to care. Again, giving permission to think about themselves. You've got to be selfish because they tend not to or think they even have a right to. It's okay to say no if you're hurting yourself or can't give the child what they need. So after can't, just include give the child what they need. And again, they really have to almost be given permission. Aunts and uncles, and by the way, this isn't just grandparents or grandfathers. This is for any relative caregiver that we're looking at. You've got to have these kind of conversations with them. Because if not, a lot of times, again, they'll always say, oh, there's room for one more, or what's another mouth, or we can bring them in, or in my family, we take care of our own. You know, in my culture, this is what we do. And like I said, it's fine. But you still need to inventory with them just to make sure that they know when enough is enough so that they're not overloading themselves. Roles and boundaries. Just kind of went over that. Just kind of refer back to that map. Where before they may have been supportive, they're now primary. Where they were advisors, they're now in decision making. Where before they were friends, they're now an authority figure. Okay? Let's look at some intervention around roles and boundaries. Goals, reframing and redefining, and look at all this. Roles, responsibilities, interactions, and relationships. Strategies, who's responsible for what? Really crucial. You get real concrete, all right? It just doesn't kind of float around out there. Who's responsible for what? How do roles and responsibilities change? And here's the conversation. Here's the script. Does everyone support the change? And then you've got to share the changes with the children. So many times we forget to pull the children into the conversation in kinship care. You know, we just assume that the children are going to make this thing work. We know children can make placements fail. Happens in kinship care as well. Well, they've got power. So you've got to share with them because they may not be comfortable dealing with the changes in the family. They've got loyalty issues. They've got issues of fantasies. They've got issues of betrayal. They've got issues of trust. And it may not make this plan work. And you've got to work and talk to them in terms of what's going to happen, how do they feel about it, And also, that's kind of like the litmus test, too, in terms of how the family members feel about these changes in families. Because for the birth parent, it may be a loss in terms of power, position, of the relative caregivers, of the aunts and uncles may be feeling losses as well. And if there are other children in the family, they've also got to be pulled into the loop, all right? Because as we saw, there were cousins involved in that network. How are they going to feel about it? How are they going to handle the changes? Okay. Guilt. Whose family does the relative caregiver feel as though they're disrupting? Whose family? The parents, exactly. Yeah. It's the birth parents' family that they feel as though they're disrupting. Granted, intellectually, they know if I don't take this child might go into care, but they may feel as though they're disrupting the birth parents' family. Becoming a primary caregiver, you can see why that might cause guilt, because they're taking the place of, right? So it's that replacement that can make them feel very guilty. But this third one, more committed to meeting the child's needs rather than the birth parent's needs. Why does that make them feel guilty? Why don't they say children should come first? Children's needs should take precedent to adults.
Because they're their children.
That's right. Their child is the birth parent. Better yet, who was their first attachment with? Who's the relative's first attachment with? The birth parent. See how this is different from foster care and adoption? The foster parent's attachment and loyalty, the adoptive parent's attachment and loyalty, and we're talking about non-related foster parents' adoption, is to who? The child. Kinship care, it's different. And that's why it can cause so much guilt. The foster parents and adoptive parents do not feel guilty about having attachments to the birth child. They don't feel guilty about that at all. Relative caregivers can feel guilty because they've had the attachment. Even if the attachment is insecure, all right, it's very negative. The fact is, that attachment was to that birth parent, and now a shifting of pre-existing relationships can make it very difficult for them. Being successful with the child. Why would a relative caregiver feel guilty about being successful with the child? The weight goes up, they're going to school, attendance is better. Why would they feel guilty? Excuse me?
You're doing a better job.
They're doing a better job than who? The birth parent, right. Doing a better job than the, all right, let's even be more specific. Their success makes who look bad?
Your children.
Your child, your brother, your sister, okay? And that can make you feel negative. Different than foster parents, different than from adoptive parents. In fact, adoptive parents want to look better than the birth parent. They want the success to be shown. You know, they want you to finalize that adoption. Foster parent wants to get that license. So they want to show that I'm not being cold, all right? But they're not out to try to make themselves look worse than. They want to show that they're just as good as, if not better, all right? So again, different kind of dynamic. You just kind of like need to be aware of it. And then being a better parent. Now, why would that make them feel guilty?
We always want our children to be better.
Yeah, you want your children to be better than you were, okay? My wife used to get so beat up on this issue. My daughter was so good at this. She would say things to my wife, things like, you're so much more patient with him than you were with me. And you're so much more nicer to him than you were with me. You know, and then she'd get on both of us, you know. You give him so much more than you gave me. You know, and we just get all beat up. I kind of knew what was going on, you know, because I kind of wrote the book a little bit, right? So, you know, I knew what was happening with my girl. But my wife, who was an accountant, she's a bottom line person, right? She was just getting beat up all over the place. And I knew it was getting bad when finally she said to my daughter, you know why I'm so much nicer? It's because he's nicer than you. He's just a sweet baby. He was born sweet. You were born mean. I said, honey, come on over here, babe. Come on. You know, it was getting bad then. I knew it. I said, hon, listen, the fact is, we are better. You know what I mean? You know, we are more patient. You know, we do things in a better way. You know, we do have more to give. So, you know, we kind of have to, like, let's not deny it. Let's kind of accept it. So my wife said, okay, you know. But I knew she wasn't just going to accept it, you know. So she was kind of like pulling the wheels together. So my daughter came back at her one day. Oh, you're being nicer. And her response was, do you want us to make the same mistakes with him that we made with you. And she never said that anymore after that. Because she had to say no. Even though she really did want to say yes. Make the same mistakes. Treat him as horrible. You know what I mean? I knew she wanted to say that. But to be a good parent, right? She had to say, no, I want you to be good. You have to treat him nice, be different. You know? So it was funny. What I finally did was, she got me on the Oreo cookies. You know, she said, look at him. You're being so nice with the Oreo cookies. I said, what do you mean? And she was right. You know, when I was teaching her kind of like how to work with the Oreo cookies, you know, because no one really had taken the time with her. So I was trying to like help her with the Oreo cookies. I guess she was like 12 or 13. So she'd hold the cookie in too long. So, you know, if you hold it in too long, it kind of melts, falls apart. And I'm saying, now you're going to drink all that milk. We're not going to waste it. We don't have any money, you know. And with him, I'd clean the milk up. Let's get a new glass. You know what I mean? Clean milk, you know. Let's count to 3, 1001, 1000, you know. And finally, I just bought her a glass of milk with the Oreo cookies, and we did it again. Here's imagine a 25-year-old person enjoying the Oreo cookie. So it's real interesting to see how those things can make a difference. So when we think of intervention, strategies, it kind of starts with, number one, you've got to acknowledge that they are better. You know, you've got to help them acknowledge the mistakes. You've got to validate how they're feeling. But to live with the mistakes, live with the guilt, here's the discussion, here's the script. What will I do different? And that's them talking, that's what you're talking with them about. What will you do different? What mistakes were made? Got to talk about having the right to make mistakes. Mistakes are part of learning. And then here's the big one. Not expecting or waiting forgiveness from others. That is so important with relative caregivers. If they don't get over that, if they cannot forgive themselves, they are vulnerable to becoming victims. The children guilt trip them. You ever seen the relative caregiver who lets the child in and the child is still stealing from them, taking food from them, still having babies, all right, and they still taking the abuse, and a lot of it has to do with the fact that they still feel as though they deserve it and haven't forgave themselves, and they're waiting for someone else to give the forgiveness. And if they can move past it, sometimes to help them move past it, they've got to know that they have a right to do it, okay, and that forgiveness leads to resilience in terms of like being able to come back. And then sometimes they still won't do it for themselves. Sometimes you may have to say, you may need to be resilient so that you can give resilience to the child, so that they know how to teach them children how to do that. And should I, you know, so I think that whole piece around resilience and forgiveness is so crucial so that they won't continue to victimize themselves. And then here's another one. Remember the one about attachment, feeling guilty about the child attaching to them? Here's how I hear it in therapy. Should I let the child call me what? Mom. All right. And really what they're asking is, should I let the child attach to me as a parent? And what else they're asking is, should I respond to the child as a parent? That's really what the bottom line is, okay? And here's the dialogue. What do the children need now? You know, they need someone to play with them, to nurture them, to care for them, to go on Halloween with them, to, you know, make the Easter eggs, to have somebody go with them to the parent-teacher's night. You get real specific. You know, what do the children need now? Who's going to meet their needs now? And what's the answer to that one going to probably be? Them. Okay? And then, if not you, then who? All right? That helps them live with the guilt. That's why that dialogue is so important. It helps them live with the guilt. They put the children's needs first. They realize the children have to get these needs met now. There's no one else to do it, and that's how they can live with it. Sometimes have to give them that rationale. Okay? Embarrassment. These are just not nice clinical issues. These are issues that if you don't address, actually become barriers to permanency. All right? If you don't address the guilt, you can end up with the phone call. My son and daughter are making me feel so bad for raising this child. The birth parent is making me feel so awful. Please come and get him. Okay? All right. So you see why these are so important? Because these can become issues that cause disruptions. You know, so these aren't just nice issues that you want to address in therapy. These can result in phone calls. Embarrassment can result in disruptions. By not dealing with embarrassments, the next thing you know, you've got relative caregivers not showing up for court, not making appointments, not following through with petitions, okay, because of embarrassment. And look at what happens. Birth parent, but again, attachment, you know, when my brother and sister's doing well, I'm doing well, okay? If they're not, I'm not. So again, back to attachment in terms of why they feel that way. Foster parents, adoptive parents may feel sympathy, empathy, but they're not going to feel embarrassed, okay? That birth parent's problems does not reflect on them and their family. Kinship care, it does. Having to ask for services. A lot of relative caregivers pride themselves on never ever having to be on welfare, never ever having to ask for assistance, never ever having to ask for grants. And now they're in court, they're going to these appointments, they're dealing with these agencies, you know, so it can be embarrassing. And again, if next thing you know, they're not making the appointments, they're walking out on appointments, and you wonder what's going on. Having to disclose the information. Remember now, they're talking about their son, their daughter, their brother, their sister, all right? You know, you've got traditions and cultures where, you know, you don't put out your dirty laundry. And here you are spreading all this information, again, very different from a foster parent or an adoptive parent. Trained professionals. It's not personal information. You know, for a relative caregiver to go to an appointment, to apply for TANF, or, oh my goodness, imagine going to an interview for intake for mental health services or petitioning. Okay, again, very, very different. And then here's another one, the reason why the child is being placed or raised by the relative caregiver. That becomes very difficult for relative caregivers. Remember when we went through the list and you talked about all those feelings? And then I added maybe drugs or alcohol while they're with me. First word out of somebody's mouth, anger, resentment, embarrassment. All right, relative caregivers can feel the same way. But what even makes it more difficult is when they have to explain to the child. It becomes very, very difficult. Again, very personal. You're talking about their mother or their brother. You're talking about their brother, your son, your daughter. And it becomes real personal, becomes very difficult to talk about disclosure. Okay? And then sometimes you're even more comfortable talking about it with friends than you are. You ever find that you're more comfortable with friends than with family around certain issues? Can feel safer with strangers than with family? I didn't hear this. I didn't understand this until I had a relative caregiver say, "Please don't tell my sister about what's going on." Okay, you know. So again, it becomes a real issue for relative caregivers in dealing with the embarrassment. And when we talk about intervention, goals, demystifying the systems. I think that is so crucial. Again, you've got to validate, talk about the feelings, and then you've got to educate the relative caregiver to the systems, procedures, policies, how they're going to be treated by people in those areas, at those offices. I forgot what it was like going to court to petition for custody. I walk in, and I walk up to the intake worker, and I said, "I have a 9 o'clock appointment for court. Where should I go? What courtroom?" Everybody started laughing. Why? Everybody's appointment was for 9 o'clock. Remember how it is in court? You know what I mean? I forgot those things, you know. And I'm a social worker, forgot. You know, and then I said, "Well, I'm supposed to be interviewed. Where's the interview room?" Where was the interview room, y'all? It was right here at the desk in front of everybody. You know, forgot those kind of things, you know. And that's what I'm talking about. They need to know what's going to go on, how it's going to happen, you know, how those workers can act in those offices, how overwhelmed the workers can act at the TANF office, how real and personal they can be, you know. So how to respond, what to do, and then disclosure is real crucial. They need to talk about what to say, who to tell, even who deserves to know, right? The other piece that goes with that is when to tell and how much. And if they learn this, who else are they going to be teaching this to? The child, right? But it starts with them, because children also need to know how to deal with the embarrassment of what to say, who to tell, how much to tell. And for relative caregivers, this is so crucial, you know. And again, not knowing what to say, how to say it, sometimes can often end up with, "I can't deal with this. I can't tell the child about their mother. The child thinks that I'm the mother, not the aunt or the uncle." How many times do you hear that story? Happens in kinship care all the time, because they haven't dealt with disclosure. All right. And then also, you need to talk to them about how they want you to support them. It wasn't until I was working with some children in foster care when I was a little bit younger, and they would say things like, listen, will you drop me off at the corner? You know, when taking them back to school, will you drop me off at the corner? Or how about this one? Are we driving your car or the agency's car? The agency's car, you can tell an agency car. You know, they've got the look, they've got the emblem. Or sometimes I'd have the children say, listen, could you leave the briefcase in the trunk? You know what I mean? You know, we can be an embarrassment. And we need to talk to relative caregivers about how they want us to support. Sometimes we can facilitate. Sometimes we need to coordinate the meetings. Sometimes we need to escort them. And then sometimes we need to be behind the scene, okay, in terms of how we're involved. You've heard work families, listen, could you come over at night, you know, instead of during the day, you know? And embarrassment's a real issue, and it needs to be talked to with relative caregivers, because you got to remember, they may not be used to dealing with the systems or knowing about systems, and it becomes real personal. Okay, projection and transference. All right, let me say this correctly now. Projection and transference is okay as long as you like who the child reminds you of. Does that make sense? When my son and daughter are doing well, who are they like? Me, thank you. And if they're having problems, mom. Well, I've gotten better now because I have to live with this woman. You know, I can't be saying you're like your mom, so I say you're like that side of the family, okay? Or her side of the family, okay? But you see how that happens? Now, if we can get relative caregivers to laugh the way we're doing here, it's okay. But when relative caregivers say you're just like your mom, or you're just like your dad, you know, if they can laugh, it's okay, but when they keep saying it, and here's the problem, if the kids pick up on the relatives feeling that way, for the kids, it can then become what? Negative, and a self-fulfilling what? Prophecy, right? Relative caregivers can create the monsters. Relative caregivers can create the legacies, you know, simply by communicating to the children that you're just like mom, you're just like dad. Oh my goodness, here's the cues. When I hear things like, oh my goodness, he told the same lie his dad did 25 years ago, you know, or she broke out the same window that her mom did 30 years ago, you know. And again, it becomes frightening. And then, you know, you really can't deny it, because sometimes the children look like them, the voices sound the same. And then the difficulty is in their being able to perceive the child as their own person. Here's the intervention: empowering the relative caregiver. And the second is getting the relative caregiver to perceive the child as being able to make choices. And I use that word empowerment very, very specifically. They've got to believe that they can make a difference. All right? Here's the dialogue. What were the birth parents good at? What were their talents? What are the birth child good at? What are their talents? Now, sometimes they'll say they don't have any talents, they're not good at a thing. All right? And they never will be. All right? So rather than get into that argument, here's another approach, another script. What experiences or opportunities could have caused the birth parent to be different? All right? So that you don't get stuck on they're not good at anything. All right? Because sometimes they can do that. They're not good at anything, they never have been, they never will be. Okay, fine. The birth parents aren't that good, the children aren't good, but what could have made them different? And then that's when you can very nicely go into what experiences and opportunities do the children need to be different from their birth parents. What are you going to do differently for the child? You see how we get into empowerment? What are you going to be difficult? And then the next question is, will doing these things be difficult for you? Now that may sound real strange, but you've got to remember, you may be asking the birth parent, the relative caregivers, to do things for the first time that they've never ever done with their own children. Okay? And it may be difficult, because now they have to also look at the fact that they've got to do things differently. They've got to take some responsibility for what happened. You know, so that's a whole denial system that they have to work through. So you may have to kind of like join with them around, now is this going to be hard to do? You know, because they may never ever got into being positive or being nurturing or being supportive. You know, this may be new, you know, but it does get them to look at what they have to do and empowering them so that they know that they can make a difference and that the children can also make a difference as well.
I just want to say that I think that's one of the biggest pieces, especially for agency people, because some of our biases are that the relatives and birth parents, our relatives and grandparents may not have the skills, and that strategy there I think is really useful in developing very different parenting skills for those relatives, or that we may be going, there's not something not quite supportive of the child in the home.
Right.
That's a great tool like that.
Okay, thank you. Because a lot of times, you know, you got to remember, you may be bringing up new issues and new approaches, and hopefully this will be kind of like a non-threatening way, you know, of doing it, because it may be a first time. They may be doing things that they've never done before. Okay. All right, loyalty. Now, you know what you can do with the loyalty? If you would, it should be loyalty / dual loyalties / disloyalty / betrayal. Can you see how relative caregivers can have all those experiences along that whole continuum? All right. And again, you can see what's going on. Replacing the birth parent can be a real issue, because it just shouldn't be them doing it. I mean, it's just that simple. You know, I shouldn't be doing this. The birth parent should be doing this. My brother, my sister, my son, my daughter. It shouldn't be me. The split loyalties, dual loyalties, well, you know where that's coming from. It's back to that attachment issue again. Who they were first attached to, you know, who they feel their first loyalty should be to. Feeling disloyal by placing the birth child's needs before the birth parent's needs. You know where that's coming from again. Back to that attachment again. Different from foster care and adoption. All right, because again, that loyalty is to the child. That initial attachment is going to be to the child, not the birth parent. Feeling as if betraying the birth parents when disclosing negative information about them to others or the agencies. And you can see why petitioning could become such an issue there for a lot of relative caregivers. This is why this whole issue of loyalty is a big issue in terms of getting relative caregivers comfortable with going for custody or going for adoption. They can feel as though they're being so disloyal when they pursue adoption. All right. Yeah. Relative caregivers' feelings of rights and entitlements in caring for that child, where does it come from? Family. What else? What makes a foster parent or adoptive parent feel as though they have rights and privileges to the child? What gives them that? States, licenses, courts. Relative caregivers feel as though they have it through family and through blood relationships. All right. So again, I shouldn't have to adopt. I shouldn't have to because they are family. All right. And then when you push them past that, it begins to feel as though I'm betraying, I'm being disloyal. You know. In fact, when relative caregivers do it, a lot of times the approach around adoption and custody usually has to be around real pragmatic and practical reasons, like safety, care for the children, providing the children permanent homes, providing the children stability. You know, that's the way you usually have to approach, at least in my experience, that's the way I usually have to approach a relative caregiver when I start talking about guardianship, custody, a legal relationship, adoption, terminating of parental rights. Got to get real practical. I mean, if you approach it with, well, this is how you can show your child you love them, or this is how you can make them feel attached to you, you're not going to buy them that way. You're not going to get buy-in that way. It's usually got to be for real practical reasons. Okay? So I just want you to know the power of loyalty and in terms of the relative caregiver's inability to follow through with a lot of those legal relationships. When we look at intervention, here are your goals. Number one, getting the relative caregiver to prioritize loyalties and responsibilities. And number two, and I know this sounds real strange, not infantilizing the birth parent. Now let me talk a little bit more about that. Here's the script. What precedes this script usually is your conversation with the relative caregiver about the birth parent. And what usually precedes these questions in this script is relative caregiver saying, if I'm not there for my son or my daughter or for my brother and sister, who's going to be there for them? Or you hear things like, if I don't let them stay with me, who's going to be there for them? If I don't let them stay at my home, where are they going to sleep? You hear those kind of conversations. In response to all those kind of conversations, you can start off with, who is less able to help themselves? Whose turn is it now? You may lose both if you try to save both. And again, we're looking at the birth parent compared to the birth child. Who deserves your help first? Again, back to whose turn is it now? Items 1 through 5 are all about getting the relative caregiver to prioritize their loyalty. And sometimes 1 through 5 doesn't even work, okay? And your last resort might be number 6. Who does the agency need to see you caring for first if you want to keep the child? All right, and that's when 1 through 5 doesn't work, all right? Because they just may blow you out of the water. They're not going to choose. They're not going to make that choice. You're not going to give them a rationale. Sometimes it just has to do with the fact that you have to demonstrate to these folks that this is where your priority is, all right? And sometimes that's exactly what a relative caregiver is going to have to say to that birth parent. You've also given them the script that they will use with the birth parent. I have to show the agency that the child comes before you in order to keep the child out of the system or at home or to get custody. All right? So you've also helped them develop a rationale. So this is a script that they not only that you use with them, but it's also a script that they need to be able to use with their child, with the birth parent, who could be the aunt, the uncle, the sister, and the brother. You see, because by infantilizing them and looking at them as so helpless, because they're still seeing them as a what? A child. You see, foster parents, adoptive parents, they see them as a person. You know, I'm still little Joe. I feel like I'm out of Bonanza sometime. You know, with my parents, on the Ponderosa, I'm little Joe, Dad's still Big Joe, but Mom will always see me as little Joe. Brothers and sisters, even with the age, you see what I mean? So that's what I mean by infantile. I'm not necessarily using it in a pathological way, but they still see them as their son, their daughter, their baby, the little brother, the little sister, all right? So by saying not infantilizing them, I'm talking about making them appear as adults and helping them see them as adults. And this is a dialogue that hopefully can help them see them as adults. And if they don't, you've got number 6 to fall back on. The system does not look at them as children. So that's kind of what 6 is all about. All right, child rearing practices. All right, let me say this very carefully. What wasn't abuse 20 and 30 years ago is abuse today.
Yes.
No doubt in my mind that my parents would have been reported. And somebody, all right. They were definitely old school. They were into corporal punishment, spare the rod, spoil the child, and I was one of those children that would run, I didn't know you just stand there, I'm running and they're lassoing me, it's terrible. They're not that bad, but you know what I mean? But just think about it. The approaches have changed, I remember talking to a relative caregiver about, time out, and she said, time where, when, you know what I mean? It's like, it's just a whole different kind of approach. Child rearing is, relative caregivers are used to autonomous child rearing. And here we're talking about shared child rearing. They're used to being exclusively in control, making the decisions as most parents are. And now they've got to share it with all these different people, birth parents, maternal family, that side of the family. Medication, real issue with a lot of relative caregivers. The whole idea of using medication. I remember a relative caregiver saying to me, I'm talking about attention deficit and hyperactivity, and the relative caregiver says, you know what the problem is with the child? They just weren't taught to be still. Raising children with special needs, there were diagnoses that didn't exist 20, 30, 40 years ago that exist today. I remember talking to a relative caregiver about childhood depression. The relative's response to me was, what do children, can you finish the rest of that? Right. What do children have to be depressed about? And I really understood, where they were coming from, But childhood depression, adolescent depression, post-traumatic stress disorder. In fact, there are needs that many of the children have today that didn't exist 20 and 30 years ago that are real challenging for relative caregivers. Drug-exposed children, fetal alcohol, so medically fragile children. So these become very, very difficult issues for relative caregivers to look at. Educational challenges. I'll never forget talking to a relative about the need to go to IEP meetings, the individual educational planning meetings and the study team meetings. And this was a relative who would not go. She'd stand me up. wouldn't get to the meetings. In fact, the social worker was almost to the point of saying, you know, this family isn't cooperating with the plan, isn't cooperating with the system, isn't following through with plans. We're about ready to pull the child out. Asked the relative, why won't you go to these meetings? The relative's response to me was, when I raised my children, I only went to school 3 times, maybe 4 meetings at the most in a year. First day of school to pick up report cards, to go to parent-teachers meeting, and if they were in a play or a show. She said, in fact, I told my children that they better not make me come up to that school. Isn't that old school? Don't make me go up to that school. She said, because when I raised children, if you had to go up to the school, it meant that you weren't being a good parent. And it was embarrassing to have to go to the school. And if you had to go to the school, it meant that your children were acting bad. So I had to reframe it in terms of you're going to the school means that you love your children, that you care for your children, that you're interested in your children. But you see the reference, you know, that you sometimes have to look at? Involvement with agencies and decision making and for approvals becomes a real big issue for relative caregivers, especially if they're foster parents. You know, they've got to deal with the CASA, they've got to deal with the social worker, they've got to deal with the family therapist. So many people involved in that. So when we look at intervention, your first goal is what I call trial and error. And I'll talk about that a little bit more. And your second goal is getting relatives to match the desired behavior and outcomes with parenting approaches. Here's the script. Let's try it your way, but if it doesn't work, then let's try this. All right? That way you don't get into the argument about right and wrong and good and bad and how they were raised. You know, it was good to finally get a little bit of gray after a while, because I remember when relative caregivers would say, what do you mean? I raised 5 children like you. You know what I mean? I have children your age, you know. So the gray kind of got good, you know, because they couldn't throw that back on me after a while. But for a lot of relative caregivers, you're talking about non-corporal approaches and therapy and intervention. Rather than get into the argument and putting down how they were raised, I turned out okay. You can hear the dialogue. You can hear the justification. All right, let's try it your way. If it does not work, then let's try this. And then you set out the criteria, how you will measure outcomes, what's the alternative plan, what's the timetable for trying something different. And a lot of times this is a very legitimate approach, especially when we talk about medication. Sometimes medication is trial and error. You know it as well as I do. You know, sometimes approaches with children are strictly, let's try it this way. And this becomes a nice problem-solving approach that relative caregivers can use in terms of getting them to look at other ways of trying things different. And then here's another one. When we start talking about matching outcomes, behavioral outcomes with their approaches, here's the dialogue. What type of skills and qualities do you want your child to have? And most relative caregivers, most parents will all say, I want them to be a leader, not a follower, think for themselves, to question, feel their opinion is as good as anyone else's, have the confidence to voice their opinion or their disagreement. Here's the part I like. After you get them to go through all the things that they want their children to do, which is a nice way to kind of set them up. That sounds terrible, doesn't it? Okay. You know, but then you can kind of talk about this. Well, who's going to help your child practice and develop these skills? And I love it when you do that to them, because then they start saying, not with me. Then that's when you know you got them to understand, you know, you know, and here it is, you know, are you allowing your child to, and this is a key word, in a respectful way, all right, to practice questioning with you, expressing their opinions, problem solving. Can you hear that dialogue? All right. And with relative caregivers, it's so important, I think, that you kind of have that dialogue with them to look at different and new approaches. And again, you may be talking about approaches that they have not used before, that are very new, that are skills that weren't practiced when they were raising children. So that's why it's so important to actually be very specific in terms of, again, it's back to empowering them. It's getting them to realize that they make the difference. They're the ones that can teach the children to do these things, but the children need them in order to develop the skills, and that they're new skills that they want their children to have. So this is kind of like an exercise. This doesn't happen one time. Sometimes the opening for these kinds of discussions are when you maybe hear a relative caregiver putting the child down, or maybe calling them stupid, or, you know, don't question me, or don't give me that look, or just do what I say, don't ask me questions. Those are openings that you can kind of like use to start talking about these things with relative caregivers. Of course, after the child is gone, not there in their presence, okay, but to bring up these kinds of issues and questions that they can talk about in terms of what do they want their children to be like, okay? All right, stress management. The things you used to be able to do at 25 and 30 become a little more difficult when you hit 40 and 50, okay? And you've got to be able to get relative caregivers to talk about it, to be able to acknowledge it, and to deal with those issues. Because a lot of times relative caregivers may not be comfortable talking about those things. And I think what's so important is that when we talk about that, here's some strategies that you might want to think about. Identifying limits, identifying support systems, resources, people, second care providers, routines. I think family group conferencing becomes very helpful in terms of a strategy and an approach that you might want to use with relative caregivers in looking at these types of issues. Bonding and attaching, we kind of talked a little bit about that, okay, a little bit earlier. Let's take another look at it in terms of what do you do about it. Here's the dialogue. He should listen to me because I'm the what? The adult. He should listen to what I said because I'm the aunt or the uncle or the grandparent, all right? So by this I'm talking about them feeling as though that they've earned attachments, respect, loyalty, intimacy, affection, bonding because of their title, just because of who they are. And what they need to realize is that they have to earn it, all right? I'm your aunt, I'm your grandparent, you should give it to me because of my title. Foster parents, adoptive parents are kind of like trained to talk about how you earn that, how you develop it. And with kinship care, with relative caregivers, it's because of blood and because of my relationship. You should just automatically give it to me. But here's the dialogue that you may have to do with relative caregivers. You don't know me as a parent. These are the things I will do to earn your trust and show you I deserve it. Now here's another piece that goes along with that. And these are the things you will need to do in order to show that you deserve my trust. Okay? So there's there's another part that goes with that. All right? So it's kind of like contracting. All right? These are the things I will do to earn your trust and show you I deserve it. And these are the things you will do to earn my trust and to show me you deserve it. So it's a two-way dialogue. It's kind of like mutual. But it all starts from the assumption that the children do not know the relative caregivers as parents. That's the underlying assumption to this whole intervention here. And what I often would forget and would also assume is that a relative child relationship, I used to assume that, say, like an aunt and a niece or a relative or uncle and a nephew relationship could very easily and automatically become a parent-child relationship. And I found that not to be true. They don't know the relative caregivers as parents. And since they don't know them as parents, you almost have to, in fact, you almost have to tap into your whole knowledge around adoption and foster parents in terms of the approach of stranger adoption, stranger adoptive parents, and stranger foster parents. You almost have to use that approach there. They don't know each other, don't know him as a child, he doesn't know them in a parental role, and you start contracting, establishing a relationship, building trust. Just use those same kind of approaches in kinship care as well. Because they may know him as a relative, as an aunt, or as an uncle, but not as a parent. And because they don't know him as a parent, they're going to have to renegotiate these issues and how to establish and how to earn it. So that's really what that piece is all about. Because if you don't, you're going to get, you're not my what? Mom, exactly. You're not my dad. You hear that in kinship care, just like you hear it in foster care and adoption. Okay? And as soon as you hear, so to avoid that dynamic, because they are going to say it, just fall back on what we know already in terms of how to help adoptive and foster parents attach in a parental relationship with their children. So that's the theory that you want to base your intervention on. Anger and resentment. Why anger with the birth parent? Not doing the job. What else? Absence. Should be there. Why would you be angry when they come back? Because they can be angry both ways. Okay? You know, they can be angry when they come back off the scene. Then they can feel the birth parent sabotaging, competing with them. Why would a relative caregiver be angry with the child for being loyal to their birth parent? Why? Ooh. Okay. All right. Because you're absolutely right. It's how the child, the comment was, it's not the child's loyalty, but it's how the child acts out the loyalty. Okay. Here's the example that I was thinking of. Have you ever been to foster parent? Have you ever been to a meeting of the child, a visitation between the child and the birth parent? And the birth parent says to the child, "Oh my goodness, you're losing weight. That foster parent didn't feed you this morning, did they?" "No." "When's the last time they fed you?" 10 days ago. You hear the child? All right. All right. What has gave the child permission to make up the story? What gave them permission? What made them feel as though it's okay to say that? Trying to please the parent. Okay. What are they picking up from the parent that lets them know that they'll be pleased by making up the story? Huh? Loyalty with me. Show me that you're not happy. Okay. Make me feel like I'm the only one that can take care of you. And the kids are picking this up, and they can make up the stories. Okay. Reaffirms, and the kids are picking it up. Mom doesn't want me to be happy here. Dad wants to hear how terrible this place is. Okay. So they'll make up the stories. And again, it's showing the loyalty. You know, it's how they're showing the loyalty. The way I'll see this happen in kinship care is when the children will go so far as to lie on the relative caregiver. And that will make them sometimes say, "Come and get this child is lying on me, I'm not going to end up being reported by da-da-da-da." Okay? So I just want to kind of like look at how you have to look at those loyalty issues and how that it can sometimes get played out. They can be very angry with you, with me, the professionals. You know, your baby snatchers, you're just here taking the children away. Or it can work in reverse. You know, you want her to visit the child, you want to return the child back. Reunification, what? How about this one? "I thought you were my worker." You ever get that one? You know, because you can get possessed after a while, you know. "I thought you were my worker." And here we're talking about reunification and visits. So it can happen both ways. But the one that also can result in that phone call, because the children can make the phone call. "He's lying on me, I'm not taking a chance of being reported." And the other one can make the phone call is when the relative caregiver is angry with themselves. How do you hear angry with themselves for being the surrogate? Why would they be angry with themselves?
The child said something to her about some situation.
Maybe the child. Okay. Why else would they be angry with themselves? What did they say they would never do? Think of the enabling relative. What's the thing that makes them so angry sometimes?
Do they feel that they're contributing?
Yes. I'm only making them worse. I'm not making them be the parent they should be. I'm letting them use me. And that can make them so angry. So angry to the point where they will say, "She knows I'm going to take this child. He knows I'm going to take this child. I'm not going to let them use me like this anymore. Come and get this child." Can you hear the dialogue? Okay. All right. So when we see relatives get to that point, here we go. Number one, here are your goals. Got to start thinking about how to help them cope with the anger and not displace it onto the child. If you notice, I don't have up there not feel angry. You notice that? You know, because remember how you felt when we went through that list about that, getting that phone call and being asked to take their children and how it affected you emotionally and how it changed your life? Yeah, it could make you angry. So rather than pathologize the anger, what we're talking about making sure that the goal has to do with not displacing the anger on the child, because we know what happens when the children feel as though they're at fault. All right? And cope with the anger rather than to not have the anger. The reason why I have that here is because a lot of times I've seen professionals clinicians, therapists, social workers see the anger and the resentment in relative caregivers and become very, very upset. In fact, I did some training with judges, and I'll never forget the judges saying to me, you know what? Relative caregivers don't seem to be properly motivated. Yeah, I wanted to laugh too. So I said, what do you mean properly motivated? Well, when I do custody petitions and when I do adoptions with adoptive parents or with foster parents, they bring cakes to to my court. They bring balloons, they're taking pictures. I'm invited to adoption parties. Relative caregivers don't seem to be happy when they leave my court. Right. See, you and I can laugh, right? Yeah, they don't seem to be happy, you know, but a lot of people just don't get it. You know, remember, look at how those children come into your care, how they come into your home. It's not going to always be a happy occasion, okay? So I'm glad you've got it, okay? Because, and please pass the message on to our colleagues, okay? Because the goal is not to make them happy and to take away the anger. You know, in fact, if they don't know that they might be a little bit upset, that might be a red flag. You know what I mean? You know, because how much denial is there, and do we have a time bomb on our hand becomes my concern. I want them to know how they feel. And if they want to talk about the anger, please do bring it out with me, okay? Not with the children. So again, coping with the anger, displacing the anger, and here's some strategies. Yes, you are being used, especially the one about being used. Here's the dialogue. Yes, you are being used, but you're helping the child because they need to have a rationale which helps them cope, okay? And yes, if not you, then who? All right, it's a very simple dialogue. It's a very powerful dialogue, okay? But I think it's a dialogue that helps them get through the feeling of why should I let them use me for the children? You know, why should I put up with that? Why should I be taken advantage of? You know, but then here again, remember we talked about knowing when it's okay to say no? You hear that line is real thin there. You know, for me, the indicator is if I think the feelings are going to spread over to the child, I want you to be able to say no. And know that you have the right to say no. Okay? You know, for me, that's the red flag. That's the indicator. If you're so angry till you think you have a right to feel that way. You have a right to not want to be used. If you think it's going to spill over to the children, then that's an indicator for maybe you need to say no. And you have a right to say no. So you see how those inventories and how that discussion kind of feeds into each other? And I just think it's so important to do that so that you're not getting that phone call and you're looking at another disruption. Here's my hypothetical with a lot of the parents. If your child is starting to make you feel as though they're using you, can you still stay a relative caregiver? And I'll do that when I do assessments, part of that inventory. If you feel like they're getting over on you, can you still hang in there? It's a litmus test. You know, the test isn't really until the proof until it happens, but to get them to think about it before it happens is another way of kind of getting them to start doing that inventory, knowing when enough is enough, and if they have support systems, okay? Another part that goes with that is placing the anger where it belongs. And a lot of times they don't want to tell the birth parent how they feel. You know, remember now, it's different in foster care and adoption. You know, they want to stay sometimes friends with the birth parent. They want to keep that peer relationship with the birth parent. They've got a whole lot of reasons for not saying those things to the birth parent. It's my brother, it's my sister, it's my son, it's my daughter. I want to stay connected. Okay, the guilt trip. So as simple as that sounds, it may not be that easy to place the anger where it belongs. And sometimes if they can't, what would you say if your son or daughter was here? Sometimes that's the closest they can get to it. What would they say? What would you say if they were here? Okay. And then support groups, real crucial in kinship care. They can feel so isolated, like they're the only one, that they shouldn't be feeling angry. And then sometimes they feel guilty about feeling the anger. Okay. You know, so you really got to normalize the feelings for the relative caregivers. It's back to that acknowledgement, back to that validating, and back to normalizing. I think that's so crucial in this process also with your intervention. I know I feel like I'm turning you into a therapist, don't I? But you see, I think social workers are therapists anyway. You know what I mean? I really do. You know, anytime you're trying to get somebody to try something new and different, to me, that's therapy, folks. You know what I mean? And these are not things that you have to do in an office. You know, these are things, you know, we do therapy anywhere. Park bench, on the way to McDonald's, you know, on the elevator. You can do these things. That's why I put down the scripts. Because the scripts The dialogues can occur in the car, on the way to court, to an appointment, and we do it anyway. They're going to ask you, should I let them call me mom? What am I going to do with my daughter? You hear the anger. You see what I mean? You hear the disloyalty. It's just that, we seize those moments as they come up, and it flows. It flows. All right, morbidity, mortality. It was my grandson that made me aware of morbidity and mortality. Oh, what did he say? Okay. I used to take him to day scare, all through the early years. It was like when he was 3 and 4, preschool, and then 4 and 5. It was pre-kindergarten. And I'd do the father-son things with him that, he needed to do. And then I guess he went into first grade, and he said to me, Pop, you don't have to come in with me. And it was a father-son, kind of activity. I said, why? Don't you want me to come? He said, no, it's okay, Pop. You don't have to come. You just go home and help Grandma. Grandma always has something for you to do. And I'm going to go, it's okay, Pop. So I'm saying, okay, all right, I'll go home. But tell me, why don't you want me to go? Go with you. It's okay. I won't get mad. Well, Pop, the strings on your lips are turning white. I said, the strings on my lip, the gray, right? So I said, oh. And he must have seen my face, like, oh, okay. He said, but Pop, I got some crayons at home, and we can color them up, and then we can come back to school, So I said, no, it's okay. So I said, you want me to get Uncle Brian to come with you? That's my son. He said, yeah, Pop, that'll work. So I said, okay. So they become aware of the age issue very quickly. In fact, here's another one. All right, he's sitting there looking at my face. He's just kind of staring and staring and staring. He said, Pop, do the cracks hurt? Oh, see, you can't be thin-skinned with the kids. You know what I mean? Do the cracks hurt? I said, no, they don't hurt. Because I've got some cream, Pop. We can put some cream on it to make it soft. So I said, no, the cracks don't hurt, But and now here's the one that really made me aware of mortality. He said, because, I hit 50, right, So, I've got my, my Centrum 50 vitamins lined up, my little echinacea, sal pimento, line that stuff up as you get older, get the herbs going, So he comes up to me and he says, Pop, if you don't take those pills, will you die? Isn't that something? So I had to say, no, I won't die. He said, because Pop, I got some vitamins over here if you want to take me. I got some chewables, he's bringing his chewables lined up. So now he's got his chewables lined up. I got mine lined up. But it's the whole idea, that they become aware of morbidity, mortality. The fact is, he didn't see his other father's friends taking pills. All right. He didn't see cracks in their line, in their head, in their faces. So he was able to see my illness and my age. It wasn't illness, but the old, the age, the possibility of being fragile, and he was much more aware of it. So there was a real issue for him in terms of what's going to happen to me if you get sick. And he noticed a difference that children don't notice when they're being raised by their parents. So for a lot of relative caregivers, it's a real issue. If they can laugh about it, it's okay, all right? But if they can't, here's some intervention that you might want to take a look at. Morbidity, mortality plans. Sounds like insurance policies, doesn't it? But you really have to do that kind of planning with them. It's kind of like, family conferencing. Who will be available? When will it be necessary? What are some of the issues that you want to look at? Shared plans and arrangements with the child. That is so crucial. With the children, they need to know what's going to happen to me if grandma gets sick, or if grandpa gets sick, or if my aunt and uncle gets sick. And sharing them with those plans are really crucial. And here's another thing. Don't be surprised if you hear relative caregivers say things like, when am I going to have time for myself? Now, granted, you're not going to put that in your plan, okay? But families need to talk about that. I've had relative caregivers say, I want the last 6 months. I want the last year to myself. If I started to become ill and I can't take care of the children, I want to be able to be in a home. Have those conversations. They're very different kind of conversations, with birth parents. But to have those conversations are really crucial and helps with their buy-in. You know, can you see how this can stop? Again, permanency plans. They don't know when they're going to have time for themselves, what's going to happen if they become ill, who's going to be there, and these are, again, challenges and barriers to permanency. Fantasies. What do you hear relative caregivers say?
When they get better.
When they get better. Okay. They're going to get it together. All right. Those are kind of like the cues. Those are the lines that you hear relative caregivers. I used to take the approach of good old-fashioned reality therapy. You know what I mean? I get real concrete with them. The time I really used it was when I was working with a mother on death row. She was telling her daughter, we're in a family meeting, right? And she's telling her daughter, I'm coming home. Saying, death row, what do you mean? And I'm looking at the grandmother. Yep, that's right. We're all telling her that she's coming home. Mom's going to get home one day. So, I'm saying to the mother, well, why are you saying that you're coming home? She said, well, I have to believe that. I have to believe it. Because if I don't believe that I'm coming home, I'll stop trying to live the day. I'll become suicidal. I'll do something to get myself hurt. So I've got to believe it. And she'd already been going through the 8 years of appeals, because in Pennsylvania, it's you can be on death row for 8, 9 years, 10 years through that whole appeal process. And she says, and I have to believe it. I even have to believe that phone is going to ring, even if I'm on the gurney. I said, phone? She said, yeah. And she's right. There's a phone usually. There's a phone in there. And that's right. That phone can ring. And she said, I've got to believe it, that even if I'm there, that the phone is going to ring. So I said, and the grandmother said, and I've got to believe that she's going to come home, and I'm telling my daughter that too, granddaughter that too, because if she doesn't, I won't have the energy. I'll give up. I need this to stay involved. I have to believe she's going to come home. So I'm hearing all this, So finally I kind of said, and if the phone doesn't ring, then what? And that's when we started to get into looking at some alternatives. So the approach that I'm suggesting looks like this. Number one, here's your goal, alternative plan. I know that word concurrent plan looks a little bit strange. I wouldn't use concurrent plans with my families, okay? All right. But alternative plans. And here's your conversation. If not, then what? You don't have to get into the fight. I used to get into the arguments with, what, you think he's going to get out of rehab? He's messed up in 5 already. Parenting classes, she's missed 10 programs already, because they need the hope. In fact, it should be fantasies/hope, because fantasies sound so pathological, But I think you need to go families/hope, because families need the hope. Relative caregivers need the hope. You don't have to get into the argument of the of what if they don't, but you can talk about if not, then what? Sometimes it sounds like, well, I hope he gets through rehab this time, and I hope they get the house this time, and I hope they go through the parenting classes, and I hope the relationship works out this time. But if not, then what? All right. Get you out of the argument. Get you out of the fight with them. You don't have to deal with what's realistic, what's not. But you can start talking about alternative plans. And then you can talk about alternative plans. When will the plan be implemented? What's the timetable? How many chances before the implementation of the plan? Okay. And the other person that the relative caregiver can teach this to is who? The child. Okay. With the children, it's concrete things like, Mom and Dad are going to come from home. Mom and Dad are going to make this visit. And they're not. They haven't been. Rather than get into the fight, put the mom and dad down. Rather than dealing with fighting with the kids, conversation that relative caregivers can have is, well, I hope so, but if they don't come, then what else are we going to do? And then how long are we going to wait? And how many chances do we need to give them? You hear the conversation? All right. Because they can then help the children through their denial. But this helps them deal with their denial. If not, then what? And I just think that with relative caregivers, that is so crucial in terms of joining with them, where you can still leave them their hope, but at the same time, looking at the reality of what's going on. All right. A little bit different from foster care and adoption. You see how it might be different? Because they don't have that attachment. They don't have that hope. They don't have that connection. But with relative caregivers, and I've seen this get in the way of planning. Because we get into the fight of fantasies. I've seen it documented, pathological denial, okay? And really it's called hope, and then they're not being concrete and realistic about blah, blah, blah. Okay, but can they come up with an alternative plan, and will they know when it's necessary to implement it? That's the piece I want to see when we start talking about assessing a relative's ability to provide kinship care. Okay? Not that they have the hope, but do they know when enough is enough? Do they have an alternative plan? Do they have criteria that they can look at? Can they help their children deal with the denial system and look at alternative plans? That's the piece that you want to get into rather than getting right into they're in denial, because you'll get stuck. They need the denial. You know, it's like they need the hope. Overcompensation. I think the first one's pretty clear. Attempts to make up for the child's losses, neglect, or abuse, right? So they're making up for the child, atone for the birth parent's inadequate parenting. They're making up for the birth parent, right? Who else might they be making up for? Themselves, right? Yeah, themselves. Atone for not adequately parenting or for not being a supportive relative, or they may be making up for the family, my brothers and sisters. Okay, we should have done a better job. Okay, all right. Now, there's nothing wrong with overcompensation, except that sometimes the extremes is what we'll see. All right, give me the extreme of this of overcompensation in this scenario. You hear the birth parent saying something like, his father always played around in school, and his father was always a social light, and he always wanted to be with the girls, and he always wanted to stay out, and I'm going to make sure with this one that he does what? Give me the extreme. Never gets to meet a girl. Right. Never gets to go out. Studies 24 hours a day. Right. You see what I mean? So it's that extreme that you sometimes hear, you know, or here's another script that I'll hear from relative caregivers. I'm going to make sure this one turns out what? Right. Red flag, you know, not so much red flag there, but then when you ask them how, okay, that's where you want to hear. And if you hear the extreme response, then that's where you begin to look at red flags and you want to become aware of. Or here's another one. I want to save this one. All right. I want to make sure this one turns out okay. Again, nothing wrong with the statement, but it's just knowing how extreme are they going to go with that. Okay, with that. And here's what we want to look at. Balance. That's the goal. And avoid the extremes. What does the child need? How do you meet the child's needs? What did they miss? And how do you balance what was missed? Gets them to look at what was missed, what was had, and that's how that's kind of like the script, the dialogue that goes with that. All right? And it's back to empowering them, getting them to look at things. Because remember now, they may have been the ones responsible for not giving them what they needed. You know, maybe they were too lenient or were too strict, and the child reacted, you know, or they didn't respond. So again, it kind of like gets them to look at what was missed, how are they going to do things differently, okay? Competition. You can see who it's with. Here's some goals. Hierarchy, criteria for how privileges are earned, don't compete or buy love and affection. This almost reminds me, when I work with relative caregivers, sometimes I feel like I'm dealing with separated and divorced parents. You know, it's kind of like marriage counseling, all right? So I kind of like really drew these rules pretty much from working with couples. And this is where it kind of comes from. What's the hierarchy? Criteria for privileges being earned. Don't compete for love and affection. And then here's here's the script. When you're with me, these are my rules. When you are with your parents, you follow their rules. And unless there's a safety issue, okay? But the not competing and vying for love, I think that's the ideal. And I kind of have those goals if you can get the two, birth parent and the relative caregiver, to work together, all right? But if all that fails, then you have to kind of fall back on these other two strategies at the very bottom, those last two bullets, okay? But ideally, so you got to remember, the birth parent is feeling like the absent parent. So just kind of tap into your literature and research and your work with separated and divorced parents. That birth parent is acting like the absent parent. They want to be loved, they want to be liked, they're feeling guilty, you know, and they're trying to make up for. And then you've got to think of the relative caregiver as the custodial parent. or the parent who the child is caring for. And their complaints are, you're making me look like the bad guy, you're making me look like the terrible person, I'm the one that has to carry all the weight, you see? So that's why you hear me say, tap into your experience around divorced and separated parents, okay? You know, sometimes it's important to talk to the birth parent, if they're there and can work with you, about things like sometimes, you know, saying to them, your children need a parent, not a friend, okay? You know, and that means that sometimes being a parent doesn't mean you can be a friend. All right, so having those kind of conversations with birth parents can help. All right, and you know, getting the relative caregiver to be able to say that they have to tell the birth parent, it'll be easier if the child hears you say, or I need you to tell the children that, or it'll be mean more for the children if you say. Having those kind of conversations with the birth parent are real important for relative caregivers to do with the birth parent. Okay? Intrusions. And you can see how it happens on so many levels. I guess what's important there is, and we talked about it a little bit earlier, relative caregivers don't feel, foster parents and adoptive parents invite your intrusion. Not that they really want it, but they want your approval for the license. They want your approval for finalization. So they invite you in, they open up the refrigerators, they let you see the homes, you know, they go to the parenting classes. Relative caregivers don't invite you in. Remember, they don't feel as though they need your approval. They feel as though that they are already approved by what? Blood, right? Sound like vampires, don't we? You know, but yeah, I've already got the approval. I got all the entitlements in the world, okay? You know, I've earned it because we're family. So again, the intrusion, so when they look at us, they look at it as though we're intruding, which is again different from foster parents and adoptive parents. And here's the strategy that we might want to think about. Help the relative caregiver survive the intervention. That's the goal. I'm kind of being smart, aren't I? But here's kind of like the dialogue. These are things we need to do together so that I can report that the child is safe with you. Okay? Now, this kind of approach came from my experience of working in a prison setting. Prisoners, you will never bond with the prisoner. We're never going to join. We're not going to have this therapeutic relationship. I'm part of the system. So the only way that we were be able to connect was around how I could get him out of prison and how I could get out of his life, all right? Which is what brings up the next one, you know? These are the things we need to do together so that I can show it's in the child's best interest to be with you so that we can get out of your life, okay? All right? So if you're looking for this warm therapeutic relationship where you're friends and buddies, you may not get that with relative caregivers, all right? Because again, you're an intrusion. But if you can talk about bonding with them around how to get out of their life, bonding with them around the child being safe with them, joining with them around being able to show that the child's best interest is to be with you, a lot of times they work with you around that, okay? You know, and I think sometimes if you start with that, then maybe you can earn some respect and then you can move from there with relative caregivers. Because remember now, they do not look at themselves as clients. In fact, one of the things that gets them very upset is when we approach them as clients. You know, they're not the problems, they didn't get reported. In fact, they may feel as though they're doing you a favor. Okay, all right. So if you approach it that way, it doesn't throw you off when you get this attitude, you know, in terms of what's going on. Kind of expect it, and let's look at, you know, what we can do so that we can, you know, get the child into a permanent relationship with you. Okay? If anything, you may even have to deal with them as if they're foster parents. No, you better not do that. Foster parents may have an issue with that. They may say don't treat them like a foster parent. Okay? But you hear what I'm saying, though, in terms of this is a peer, it's a team, we're working together. Okay? That don't look at me as an extension of my child's problems. Okay? You know, that's what they'll pick up from us sometimes. Okay? All right. Let's see. All right. I figured at this point I would just kind of like open it up for any questions or responses or additions, because maybe people have other other clinical issues that they've seen or that they might have addressed, and then I can just kind of like add them, and maybe we can talk about other approaches. Yes.
How do you deal with the relative that is, like, the apple doesn't fall far from the tree? So you see, as the social worker, you can't take that approach because there's so many issues with the relative, but yet you really want to work with them and place with them. So
okay.
how do you deal with those?
Well, you see, it's kind of like a very similar approach here. I have actually said to relative caregivers, there's some people that don't believe that children should stay with relatives, don't you? And I'll tell them, and a lot of times it's because they think that the apple doesn't fall far from the tree. And they'll get so angry. And I said, yeah, you're right. I could see you being angry. But what do we need to do to show them that you can take care of these children, or that you can protect them, or that you don't have the same problems that their birth parent has? So you move them into, what are you going to do differently? How are you going to raise the children? Okay? So I think rather than not bringing up the issue, I actually bring it up, because relative caregivers need to know that, and a lot of them know that already. That's why they know that a lot of people are putting them on the defensive, So a lot of times I'll just bring up the whole issue of legacies and traditions and how to break the cycles, and apple being not being far from the tree. In fact, sometimes they know that they started the legacies. Who was the first one to go to jail? Who was the first one to be incarcerated? Sometimes the birth parent will tell on the relative caregiver, you putting them with my mother? I smoked my first joint with her. Okay? So lots of times the birth parents are putting out the dirty laundry. And you've got to go back to the relative caregiver with, listen, this is what's come out, this is what's been said, especially when you're in the assessment process. Especially when we're doing assessments and you're starting to consider placing and all this stuff is coming out, you need to bring up those issues right up front in terms of legacies, bad apples, what you have to show, how to get me out of your life, how do we need to show that the children are safe with you, okay? Does that make sense, I guess? Okay. Yes?
I work with a newly forming kinship care legal services program.
Yes.
We're just barely getting off the ground. And I noticed one of your earlier slides addressed perhaps relative caregivers who don't appreciate being called into court, and some ways to work with them dealing with the courts and getting custody, legal custody of the children. But from my understanding, many folks who have physical custody are not necessarily interested in pursuing legal custody. And I was just wondering if you wouldn't mind taking a minute to share why you think it might be a good or bad idea to pursue the legal custody a little bit.
Right. I think I kind of touched on it very lightly. What are some of the barriers to legal relationship for relative caregivers? I think when it's a safety issue for children, legal relationships are important. Permanency issues for children, I think it's important for the legal relationships to be there. Getting services for the children, they need legal services there. In fact, this is my conversation with relative caregivers that I'm having with you in terms of when is it necessary to have a legal relationship with that child, okay? And I think talking with relatives very specifically about that is important to identify when a legal relationship is important. There's a second part that goes with that, is talking about what type of legal relationship should you have. Are we talking custody or adoption? Okay, because that also becomes a real tough issue. For me, a lot of times, looking at where the child is dictates, are we talking guardianship versus, and I don't want to use the word versus, but guardianship or adoption has a lot to do with which way you go. Because I've seen children say, I don't want to be adopted, I know my last name, I know who my parents are, and I think we have to consider that. Are we looking at reunification as a possible goal? Those are some of the criteria that you might want to look at when we're looking at guardianship. I don't know if it's called guardianship or custody in your state, but guardianship as opposed to adoption, I think that makes a big issue for a lot of for the parents. I think if we're looking at safety issues, in terms of will this parent come back and appeal for custody, and is this going to be disruptive to the children and cause acting out? You know, again, those are kind of issues that you should look at when you're looking at guardianship or adoption. So I think it's two parts to that conversation. You know, when a legal relationship is necessary and which legal relationship is most appropriate. Okay. I'm hoping one day there might be something in between guardianship and adoption, and I think we're working on that in Pennsylvania, where there's like finances connected with the legal relationship without having to adopt, you know. So I think we're slowly kind of realizing that adoption is not for but not all relative caregivers. Because I think there was a problem of defining permanency for kinship care, meaning adoption, and we just can't assume that. Okay. Yes.
How do you feel about elderly grandparents or relatives, small children being placed with, people 70 or over?
Yeah. See, now I'm biased. You shouldn't ask me that. You know what I mean? I'm 56. You know what I mean? So I'm not going to give you an objective answer. Let me try to be objective. Morbidity, mortality. You have to look at that, you know, in relative caregivers. For one thing, first I think you have to look at the children. There are some children, have you ever been with children where you know they just can't take another loss? You know, so I think you have to factor in this child's tolerance and ability to deal with the loss of another significant person in their life, either to illness or to death or whatever. So I think we've got to look at the children's ability to deal with that. I think the other thing that has to be looked at in terms of morbidity and mortality is what plan does the family have for the child, you know, in case the relative caregiver does become ill or, you know, or does die, you know. So I just don't think age should be just taken exclusively as a factor in and of itself. Because if you just take age, you'll be excluding a lot of people, all right? But I think age, as well, given consideration of the child, as well as age in relationship to the family's ability to support the relative caregiver, and age as it relates to the relative caregiver's ability to care for the child. You know, yeah, I think you have to look at, you know, an infant with a relative caregiver who's not ambulatory. You've got to look at that combination. You know, now if there's support people in the home that are there, secondary providers, care providers, then maybe you can begin to look at the picture. You know, but I just don't think we should just narrowly look at age, morbidity, mortality in and of itself without looking at the child support systems and the parent relative caregiver's ability to care for the child. I think all those factors have to be taken into account.
I work primarily in the informal system, and 90% of our relative caregivers in Washington State are informal. So there's a huge, probably a huge number. And I know when it comes to making legal commitments, a lot of times with the informal caregiver, they don't want to rock the boat. We don't know where that child may be, or we may know they're in this state or whatever. And once you start legal proceedings and you've got to get that child served, they just don't want that child surfacing. So it's easier just to keep the status quo than to start that whole turmoil of the legal process, and so they hesitate.
They hesitate. Good point. Here's the other thing I've seen come up in so many hearings. Child has been in foster care for X number of months. Relatives did not surface, and then all of a sudden surface at the point of terminating parental rights. And then you've got the issues of attachment. Where were you? Please be aware of the fact that many times relatives will not come to the surface until it's the last resort. A lot of times they don't want to rock the boat until it's the last resort. And they know where the children are, they know what's going on, and then we hit them with, you should have been there at the beginning, right up front, where were you? And we're looking at it as a negative, and you're questioning their commitment. You know, so for relative caregivers, sometimes you have to be aware of the fact that they're not going to step at the beginning. In fact, they're going to many times not step up until it's the last resort, because a lot of times they don't want to be accused of taking the child away from the birth parent. They don't mind stepping up when it's the last resort and the child has been taken away from the birth parent by the court system. Then they feel as though they should. But I've seen that misinterpreted over and over again, and I've seen it happen from guardian ad litem's to court officials to social workers about where were you, what was going on, why didn't you step up earlier. What I am doing now with relative caregivers, and that I suggest you do that now also, is at the point children are going into care and you know relatives are taking that approach, you need to deal with them right up front and letting them know, now I know you may want to not do anything until it's the last resort, don't want to be accused of taking the child away from the birth parents, don't want to rock the boat, but if that child is in foster care and attaches to a foster parent, and has been with that foster parent for 6 months to 12 months to a year and a half, the child, you may be jeopardizing your chances of that child becoming part of your family because of attachment. You need to talk about those kind of issues, and that you may have to weigh what's more important, this child being with you or the family being angry with you. So be upfront about what's going on with that, because a lot of relative caregivers think it's okay to wait, and it can end up hurting with them. So right up front, family group conferencings, letting folks know what's happening, I think is real important. Because I'm sure we've all seen that happen. And relative caregivers, so often you find them in another country, in another state, and they'll tell you, well, I knew what was going on all along, and I didn't want her to be mad at me, I didn't want my brother to be angry with me, that her mother is my sister, you know what I mean? So yeah, but sometimes you really have to let them know attachment can get in the way, and the courts are not going to jeopardize attachments because you're a relative. Okay, so thanks for bringing that up. Mm-hmm. Mm-hmm.
This is outside of regular the kinship in child welfare, but there seems to be an increased number of kids returning home. Do you see that impacting kinship and those types of issues where you have there seems to be increased intergenerational households? There seems to be kids staying at home. We can't kick little bubbas out, really easily. I'm wondering what impact is that going to have, or have we even thought about the type of impact that will have on the kids that we're raising right now?
Well, I think we're being forced to think about it. I mean, the numbers are going up. 2 million children in kinship care in 1997 to 4 million in 2000. 10% of the children now being raised with relative caregivers in the absence of parents. So I think we're going to have to look at, well, hopefully we can look at what do we need to do to stop families from dissolving, all right? But if it's happening, we may going to have to look at what do we have to do to support relative caregivers, in that role. And it's long term. It's not 2-3 years. It's, 5, 10, 15 years. What are we going to do that? And it's interesting, the children are adjusting, right. And I think the research is saying children would rather be with relatives than in foster care. They feel safer, so, and it's not new. Like you said, kinship care isn't new. So I think it's a natural alternative. It's just how do we support it, for me, is the issue. Mm-hmm. And how do we have to stop families from being forced into it if it's not necessary. Okay, any other questions or comments? My body says it's 12 o'clock. Monique, I'm terrible at endings, aren't I? That was a terrible ending. East Coast time. Yeah, but this didn't feel like work, so thank you. It was a lot of fun. Okay, y'all take care.